Okay.
Hello and welcome everyone. I have the pleasure of welcoming Dr. Shritosh Kumar today in the Aiims studio, who has secured a rank of 86 in the Aiims November 2016 postgraduate medical entrance exam. Wonderful performance. We congratulate you, Dr. Shritosh, on your performance. How are you feeling? Just share with us.
It feels great to be among the top 100 students in the country. I have no words to express it. I've been giving it my Aims exam for the past 3-4 times, and this was my 4th attempt. And the last time in May I got 313 rank. So improving from that, I could have done better, but I think we'll go steadily from here. So it feels great. Yeah.
Yes, definitely yes, and you've done exceedingly well in your performance. Well, everybody would like to know from you that how did you prepare for this exam?
Actually, my whole technique was quite different. I started preparing for USMLE before entering into the All India postgraduate examination schedule. So I completed all my basics before that only during my internship, and after that I joined a test and discussion here in DAMS. And so what I did was to make my basics quite clear and to integrate my subjects, not to read them separately, but to integrate each and every topic. If I'm studying anatomy, I'm looking at orthopedics. If I'm studying medicine, I'm looking simultaneously at biochemistry. So my approach was quite integrated. Yeah.
Well, that's very nice to know. And when somebody prepares for the tough exams like the postgraduate medical entrance, time is the biggest constraint. And another thing is, a guide who could help you in your preparation. So how did you manage your time, and how important was DAMS in your preparation?
Yeah, actually, in Aims and All India papers, I think there is ample amount of time. This paper was a little bit lengthier, so the time was little on the shorter side. But I think it is quite approachable if you keep on practicing all your grand tests and everything. So I think it is approachable. The PGI papers are a little bit longer, and they need a little bit of supervision on your side. But I think Aims and All India papers can be done easily if you are starting very effectively from the first question only. So I think my approach was already to from the first question I wanted to give it at a shot. Like I wanted my first question to be in a hurry, not like skipping things, but I was on my toes all the time. So.
And how was DAMS important in your preparation?
Yeah, I joined DAMS TND in January, and all my I completed my syllabus before that only, but I had a little bit of idea, like the questions will be like this and questions will be like that. So DAMS made me stick to my path. Like if I'm completing my one subject in 5 days, and it could have been done in 4 days, I did that. I used that one day for my other revision subjects. So I think DAMS helped me in managing my time, managing my subjects.
Was the faculty helpful to you in telling you some important tips how to approach the exam?
Yeah, let's see, every exam has a different pattern, right? If you're going to Aims, your mind is working like, I'll be seeing some image-based questions, I'll be seeing some clinical questions, more of recent papers you will find more of trauma questions. So all those topics were quite covered in the classes, and the teachers focused on each and every topic. Like if you are preparing for Aims, they'll tell you that this topic is important for Aims, and you know that it is more of clinical oriented work. You're not just reading and you're just applying there. So I think DAMS helped me in that.
So in the light of the fact that DAMS faculty was very much telling you and putting flags while they were telling you the question or discussing the questions with you. So in the light of this fact, how did you prepare? What was the method of your preparation? Were you more selective under the guidance, or you went extensive?
Actually, I was kind of both, because I couldn't read. Nobody can read because I dropped my 1 year, right? So nobody could read entire Harrison, or nobody could read entire Nelson in this time. So what I did was I identified few topics which were important. Suppose if I'm studying amyloidosis, then I studied from Robbins, just a topic, just that topic, not the whole Robbins and not the whole of the Harrison, just few topics. So I selected my important topics from there, and I went from that. So it was kind of extensive, but a little bit of selective. So
Well, that's very nice to know. And let me remind my viewers here that I'm talking to Dr. Shritosh Kumar, rank 86 in Aims November 2016 postgraduate medical entrance exam. We have been talking to each other, Dr. Shritosh, before this interview also, and you have told me that you could not take the DVT session as conducted by DAMS in the Talkatora Stadium. But let me just tell you here that you missed out an opportunity. This time we had made a record all over the country for the live classroom for doctors that has been done anytime, that was attended by around 15,000 doctors, and we have applied to the Limca Book of Records also for this, to which they have approved. Nevertheless, you have got very good rank, that is rank 86 in the Aims November 2016 postgraduate medical entrance exam. Just can I have some more inputs from you regarding the DAMS CBT that we conduct, or mock test?
Yeah. I appeared for the CBT. This was my second attempt. In the first attempt, I got 1800 rank exactly, and this time I got 582 rank. So it was a sort of indication of where I will be standing among the students. Hopefully, I did more than that. I secured a 500 better rank than my CBT rank, but that is all relative. But it really helps, because you're going to an exam center and you're appearing for all the exams, just like you're appearing for your actual exam. So it really helps to give all those exams here.
Well, in fact, that is the main idea, to give you the real feel of the actual exam, plus a real standing to where you stand.
Yeah.
It works as a litmus test, I've been told by many of the interviewers. Let me just ask you about the DAMS evaluation system, that is the grand test and the subject-based test. With that, I also include mop-up and the semi-finals that we do. What is your take on that?
Okay, so I appeared for a few grand tests, not many, but I periodically I gave few of grand tests. So my first grand test I gave out of 300 questions, I could manage only around 140 or 130 questions. So that was not very good, but over a period of time, I guess, by applying all those things which I've studied in DAMS and in TND, and managing my time more effectively, I recently I gave the last grand test, I got around 210 right out of 300. So jumping from 130 to 210 takes a lot of effort.
Yes, it does.
So, but I think it is very helpful, because apart from the actual exams, there is no other way you can assess yourself if these grand tests are not there. So I think these grand tests really help you estimate yourself.
That's very nice to know. You did mention in the past question that you joined DAMS in January 2006.
Yeah.
Right? So whatever time you spent with us, during the preparation, right from the joining day till the time you took this exam in November, what difference did you feel in yourself?
Okay, so I joined the fast track TND, which completed my syllabus before May Aims. So I completed all my subjects till then. Few subjects I could not manage to do, so I did all those after that. So what DAMS did was to make my approach relatively selective, because the subject is too vast and you cannot study everything, and you have to identify the important topics. You cannot just take an entire book and you complete from first word to the last word. So finding those important topics is a big challenge. You need to have some guidance. The teachers really help you in that. So DAMS really helped me in managing my time and managing my subjects, and the teachers really gave you important notes and everything. So it was really helpful.
That's very nice to know, and let me remind once again to all my viewers that I'm talking to Dr. Shritosh Kumar, rank 86, Aims November 2016, postgraduate medical entrance exam. Well, Dr. Shritosh, just share with us which faculty at DAMS did influence the most for you.
Yeah, I relatively enjoyed surgery, radiology, OBG, then dermatology, and psychiatry the most among all these subjects. Actually, all were good, but these were at excellence. I can't describe. Surgery especially was very good. So and surgery is one of my better subjects, so I quite enjoyed that. So.
Well, I could just understand because you were mentioning surgery and your area of interest also.
Yeah.
So probably you would have decided to go with that. But let me just ask you: have you decided upon something?
Yeah,
or
I'm
you
still considering.
taking your time?
Yeah, I'm still considering my options. My rank is relatively on the higher side, so obtaining surgery from this rank is a little difficult. But let's see. Let's hope for the best. There are a few more exams coming up, so and I'll advise all the students to not to give up at this time, and even I'm preparing for that. So let's
We
hope
wish
for the
you-
best.
We
Yeah.
wish you all the best, and we sincerely pray that you get the branch you wish to get into. Before we wind up this conversation, any message to your juniors regarding dams?
Okay. So I think you should be thorough with your notes. Be thorough with your approach to your particular exam. Like every exam is a different way in which it is conducted, and the syllabus is quite different. The whole package is similar, but the way it is intended to for you to give, like for PGI, for Aims, for AIPG, everything is a little different from each other. So you have to be mentally prepared. You have to integrate your subjects well. You don't. Yeah, I don't think it is advisable to study each subject separately. If I'm studying one subject and I'm studying another subject of the similar topic, and I separate those two topics, it becomes quite difficult, to integrate those things. So I think it is very important to integrate the subjects, and DAMS really helps in that.
So, do you suggest them to join dams?
Yeah, sure, no problem about that.
Thank you very much.
Okay.
This was a very good interview with Dr. Shritosh Kumar, rank 86, Aims November 2016. We wish you all the best. God bless you.
Thank you so much. Okay, thank you.